Assalamualaikum warahmatullahi wabarakatuh. Hi, my name is Keysa Zahwa Azis. I was born in Kendari, April 22, 2003, and I come from Kendari City, Southeast Sulawesi. The activity I did last night was after Maghrib prayer. I had dinner with my family and then washed the dishes. After washing the dishes, I went to my room to pray Isha and study while doing my course until 9 p.m. After that, I watched some funny videos on the internet and read novels until 10:30 p.m. Then I went to wash my face, brush my teeth, put on my night skincare, and go to bed. So, in this video, I will discuss what I have done to avoid the COVID-19 virus. In the midst of this pandemic, we should keep up cleanliness to support our health to avoid the COVID-19 virus. So, what have I done to avoid the spread of COVID-19? First, washing hands properly. Washing hands properly is the simplest but the most effective way to prevent the spread of the COVID-19 virus. Wash your hands with running water and soap for at least 20 seconds. Make sure all parts of your hands are thoroughly washed, including the backs of your hands, wrists, between your fingers and nails. After that, dry your hands using a tissue, clean towel, or hand dryer. 2. Using a mask or towel. Using a mask or towel is not fully effective in preventing exposure to germs. The use of this mask can still reduce the risk of spreading infection disease, including coronavirus infection. The use of a mask is recommended for people who are sick to prevent the spread of virus and germs, rather than for healthy people. However, we still have to wear masks, especially when going out of the house. 3. Maintain endurance. Maintain and increase endurance. It is recommended to eat healthy food, such as vegetables and fruits, and protein foods such as eggs, fish, and lean meats. In addition, regular exercise, adequate sleep, not smoking, and not consuming alcoholic beverage can also increase the body's resistance to avoid the transmission of the coronavirus. 4. Implement physical distancing. Physical restrictions are one of the important steps to break the chain of the spread of the coronavirus. This can be done by not going out of the house. Expect for action or urgency needed, such as shopping for groceries or medical treatment when sick. 5. Keep the house clean. Apart from personal hygiene, it's also very important to keep the house clean during the COVID-19. This is because the coronavirus has been proven to survive for hours, and even days on the surface of an object. Therefore, the house must be regularly cleaned and thoroughly disinfected, including furniture and household appliances that are often touched, such as doorknobs, television remotes, wardrobe pieces, and table surface. 6. Vaccine. Vaccines are not 100% able to protect a person from a coronavirus infection. This infection can reduce the possibility of severe symptoms and complications due to COVID-19. In addition, the COVID-19 vaccination aims to encourage the formation of herd immunity or herd immunity. This is important because there are some people who cannot be vaccinated for certain reasons. People who are not recommended to receive vaccines or who are not a priority for the COVID-19 vaccine include children or adolescents under 18 years of age and people who suffer from certain diseases, such as diabetes or uncontrolled hair pollination. So by getting the COVID-19 vaccine, you are not only protecting yourself but also those around you who do not yet have immunity to the coronavirus. Okay, what if done? Avoid the spread of COVID-19 in the midst of this pandemic. I hope it's not only me who applies it, but you too. Thank you for watching my video. More and less, please forgive me. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Dadah.